Hey there, in this video I'm going to be talking about hair loss in women. Just like men, there are lots of women who also deal with hair loss. It might be surprising for you to learn that about 40% of women also are affected by hair loss compared to about more than 70% of men. However, it is important to recognize that hair loss in women is less socially accepted and therefore can be a lot more devastating to those women who are suffering from it. When it comes to hair loss, we have a pretty good understanding of why it happens in men. In guys, more than 95% of hair loss is due to something called DHT. This androgen hormone causes hair to become smaller and thinner over time until eventually the hair stops growing altogether. And in women, androgens are also the most common cause of hair loss. However, we still don't have a very clear understanding of the exact mechanism for women. Women also have a much larger number of reasons for why they might be losing their hair, such as thyroid disorder, big changes in their weight, such as during crash dieting, not getting enough of certain vitamins and minerals in their diet, especially iron, or big hormonal shifts, such as during pregnancy, giving birth, and menopause. Women are also more susceptible to immune-mediated causes for their hair loss. So as you can see, hair loss in women is a bit more complicated, but we're working hard to try and understand it better so we can develop more effective treatments. Given the complexity of female hair loss, it is not surprising that the treatment options are also complex. Currently, the only FDA-approved medication to treat female hair loss is topical minoxidil. However, alternative treatments can include the off-label prescribing of certain medications. For example, finasteride, which is not approved for the use in women, has been prescribed off-label to some postmenopausal women with limited hair regrowth. Another medication called spironolactone, which is a water pill that has anti-androgen effects, has also shown limited improvement in some women suffering with hair loss. The off-label prescribing of low-dose oral minoxidil has shown modest improvement in hair regrowth in women suffering from hair loss. However, compared to the topical formulation, the oral medication has a higher risk of side effects such as unwanted hair growth in other areas of the body other than the scalp. Other treatment options for women include PRP and low-level laser therapy. Camouflaging hair loss using hair fibers, hair pieces, and wigs is another option. And last but not least is hair transplant surgery, which is the only permanent solution to treating hair loss. However, the pattern of hair loss determines who could be a candidate for this treatment option. The majority of men have a specific pattern of hair loss that often starts with a receding hairline and spreads to the top of the scalp and crown area while leaving a healthy donor region, which is why most men are candidates for surgical hair restoration. It's because they have a pattern loss with a stable donor. Meanwhile, the typical pattern of female hair loss is characterized by diffuse thinning of the hair while keeping the hairline intact. But unlike most men, female hair loss often involves the donor region as well. These next series of images illustrate why less than 5% of women dealing with hair loss are suitable candidates for hair transplant surgery. Here you can see that this woman has significant hair loss and thinning at the top. She had been using PRP to treat this area for the past several years. Initially, she saw an improvement in hair density. However, over time, the treatment stopped working for her. This is because the platelet activation needed for PRP causes inflammation, which in turn causes fibrosis and scarring, and this actually hinders hair growth rather than helping it. With these other images, you can see why she is not a candidate for hair transplant. Like most women with hair loss, she has diffuse loss that also clearly involves the donor region, making it unstable. And hair from an unstable donor region cannot be successfully transplanted because it is at a high risk of being lost over time. So which women with hair loss are suitable candidates for hair transplant surgery? This woman and women with hair loss like hers that is patterned with hairline recession or thinning that is located only at the crown and who also have a healthy and stable donor region are eligible to undergo a hair transplant to treat their hair loss. Another group of potential hair transplant candidates include women with traction alopecia, which is hair loss caused by constant tight pressure on the follicles due to certain hairstyles such as tight ponytails, braids, weaves, and extensions. This constant pressure damages the follicles, which eventually stop producing hair. These women may be eligible for a hair transplant procedure if they change their hairstyling methods that cause the alopecia to begin with. There are some women with congenitally high foreheads, and these women with naturally high foreheads who wish to lower their hairline are also potential candidates for a hair transplant procedure, as was this woman. Other female candidates for hair transplants are those who have experienced hair loss due to trauma, but who still have healthy donor area, as are those who are looking to conceal surgical scars located near their hairline. Although the process of hair loss in women is more complex and the treatment is more challenging, there are several options available to help women suffering with hair loss, including the off-label use of certain medications. However, if you're a woman with any of the conditions that can be treated surgically, a hair transplant can be a great option for you. As always, thanks for watching the video. I hope you found the content interesting, and please stay tuned for more videos in the future.